moving on. And on that note, using your mind to focus on what is possible and delete the what is not possible, the negatives. We're going to start today's presentation. Is one of our many series that we're going to be talking on every aspect of clinical research, trying to demystify it and bringing new ideas of how to better patient outcome. This is IMGResearch Consortium. We're a group of medical doctors, students alike, who are interested in clinical research. We're focused on demystifying all aspects of research and helping our patients with a better patient outcome in every sphere of medicine. Our presenter today will be Dr. Onyi. Dr. Onyi is a master's in public health student in University of Central Michigan. She's a prolific author. She's a well-versed researcher. She's published many papers in her sphere, in her domain, and she'll be talking today on a research question. This is the first of the research series, and we're going to have it in a form of conversational style and presentation style. In clinical research, one of the few first things that we do is to ask ourselves, what do we want to research? What do we want to do? Dr. Yi, you could take it up from there. And we encourage other people to turn on their videos also. It makes the recording more engaging and more interesting to watch for the generations unborn that may benefit from it when we upload it to YouTube. Thank you.
All right. Thank you for that introduction. I have a slide that I would like to share in the course of this conversation. So can I share my slide?
Sure. I've made everyone co-admin so they could share and take charge of your screen. Welcome, Dr. Rahman. I see you. Dr. Bosede, Dr. Mananda. I also see you.
Okay. So the first talk for this mini series is formulating a research question. I know that most of the people on here are applying for residency, and especially as IMGs, the need to have publications the pressure is, I know it's there. And so this is just to tell you that coming up with research questions or writing your own research to publish is not as hard as you think it is. Because I remember starting myself and going out of my comfort zone and going out of my way to reach out to professors, the ones in my university, the ones I met on LinkedIn, and, just putting yourself out there and working with them, bringing your own ideas and having them listen to whatever you have to say. Most people in the medical field are usually welcoming and willing to help, like Dr. Ogobi here. So let's start with, okay, I have to reduce this. I don't know how to do that. Let's put this here then. Can everyone see my screen?
Sure.
Okay, so two things that I want us to get out of this talk is learn how to define an answerable research question. So a research question is a question that needs an answer, really. The second one is discuss characteristics of a good research question. So research, there's really no good and bad, but you want to be able to put out there and say, okay, in 10 years, I published 1, 2, 3, 4, 5. How relevant is it today? That's what really makes a good research question. That's what makes a good research. So this is going to be a very, very short 20, 30 minutes max conversation, okay? So I need to be able to reduce this. I'm not sure how to hide. Exactly. All right. So what is a research question? A research question is a specific inquiry which the researcher, me, you, Dr. Ogobi, seeks to provide a response to. It resides at the core of a systematic investigation, and it helps you to clearly define a path for the research process. A research question is usually the first step in any research project. So you want to write something on, let's say, for instance, migraines. you should be able to come up with a question. What about migrants do I want to write about? What is out there that I want to add to? What is out there that I want to probably demystify to? Because research is not only adding new information, it's correcting wrong information that has already been published. Because something might be correct, and in medicine, we know that things evolve all the time. Things evolve every day. So something can be there today, a medication can work today. There's a research out there that, oh, this novel medication does this. And then 10 years down the line, we see, oh, it doesn't do as much as it says it does. And you can write a paper on that saying, okay, so this medication or this drug used to do this. Now it doesn't do this. And this is the reasons why. This is the research. This is the statistics I have to back it up. And you put that out there, and that's research too, you know? Okay, so let's move to the next slide.
So, Dr. Onyi, you remember we said we're going to make it a conversational style just to add in. So, are you saying that a research question is almost the same thing like a research objective? That is, what do you seek to find?
Exactly. So, like I said earlier in, I think the second slide, learning objectives.
Right.
Yeah, you can also say that. So it's what are the questions that this, or what are the questions that this research is answering? So by the time you're done, if I pick your paper and I'm reading it, and your paper says, I think I'm stuck. I'm trying to move my slide, but it doesn't seem to be responding.
So I'll just try stop sharing, then reshare again.
Okay. Share, stop share. Okay. And reshare. Share screen.
So while you're doing that, invariably a research question is more like, what question do you seek? What are you trying to solve? What are you trying to answer? What are you trying to find? What are you trying to, what is the question you're trying to, find? Go ahead. Are you there?
Yes. Okay, let me share my screen again. Sorry about that, guys. Yeah. Okay. Is it better?
Yes, I can see you now.
Okay. All right. So move this to the corner. Yes, this is better for everyone. All right. So this is just a sample of a research statement. This statement is, the purpose of this study is to describe and compare the attitudes of and performance of master's and PhD graduate students regarding required research courses at Harvard. There's two things that this statement is addressing. Describe, and what are we describing and comparing? Attitudes and performance of master's and PhD graduate students. So if you wanted to write something on this is a broad statement, right? If you want to write something on this now and we title it, oh, a comparative study showing or comparing and describing the attitudes and performance of master's and PhD graduate students regarding required research courses at Harvard. Let's make this interactive. What do you think this paper would look like? This is just a topic that I came up with. What do you think this paper would contain? What should be in this paper? For you to be able to say, okay, I have a paper that I'm submitting to a journal for publication. Anyone?
Can you comment? I didn't get the question.
Okay, so the question is, looking at this sample research statement, if you were to write something about it, what do you think would be in the paper? What would be the objectives of this statement? If I were to say, okay, I'm writing this paper and I want to send it to Curious, for instance, to publish, if I pick this paper with this topic, what should I see in it?
At least you should see a comparison between master students and graduate students.
And PhD students.
Yes, PhD students.
If I choose to add other courses, and then it says specifically regarding required research courses. And so we'll go based on the assumption that, well, PhD students, they've done masters already, right? So they probably will do better. We're going to probably assume that, they will do better in research courses because they've done masters before, and now they're doing their PhD compared to just master students. But then you might be surprised that you actually carry out this study and you send out questions. You probably look at the papers that they write, you look at their grades in these courses. You might be surprised to see that the master students will do better than the PhD students. And there'll be multiple reasons for a result like that. It could be that, oh, the master students think, well, this is my one chance to really get this done, right? They put in their best compared to a PhD student that would say, well, I've done this before. I have a master's in this, and be more relaxed. Do you get? So these are different subtopics that we could research in terms of this research statement. Anything else?
No, go ahead. We're listening.
Okay. So another research statement is, where all doctors here, I'm assuming, is tamoxifen and breast cancer. This research statement says tamoxifen reduces the risk of breast cancer during 4 years of use by women at high risk of breast cancer. So from this statement now, I came up with 4 questions. You could come up with more. And these questions would help you, be more concise in writing your research. The first one here says, does tamoxifen reduce the risk of death due to breast cancer? So if you want to write a research on this first question, what do you think would be the right way to go? You probably take people that have taken tamoxifen for 4 years plus, dead and alive, or maybe just dead, right? And look at, okay, so did these people, when they died, was autopsy carried out on them? Did they die of breast cancer eventually? And if they died of breast cancer, why? Did tamoxifen reduce their chances of getting breast cancer or dying of breast cancer by 10%, by 20%, by 30%, The next question is, how long should treatment be continued? So if after the 4 years that you've taken tamoxifen, has it reduced your chances of, getting your risk of getting breast cancer by how many percent? If you take it for 5 years, if you take it for 6 years, does it have side effects after the 6th year? Does it have side effects after the 5th year? Because this statement only says 4 years, Another one is, will the use of such drugs might other drugs with the same action as tamoxifen be beneficial without the risk of tamoxifen-induced thromboembolism? So this is saying that, well, now we've established tamoxifen could lead to thromboembolism. Are there other drugs that work like tamoxifen? And if there are other drugs that work like tamoxifen, do they also have this side effects, right?
So if I may understand what you're trying to explain, or probably re-echo what you're explaining, you're trying to say that a research question will have some specific components like the population, the time frame, and the little acronym they call PICOT. Is that what you're trying to? Good.
Okay, so I think this is my last slide. This is just a way of breaking down something from being a broad topic to a research question. The first broad topic here is women's health. Okay, I wake up this morning, I want to write something on women's health. I'm passionate about women's health. I cannot just sit down and say, I want to write a research on women's health, right? And so you break it down. Do I want to write something on women's health and, I don't know, childbirth? Do I want to write something on women's health and cancer, which is what I have here. And so if I choose now to say I want to write something on women's health and cancer, there are different types of cancer: breast, lungs, brain, liver, ovaries. And now I choose to write something on women's health and breast cancer. So you can see I'm filtering my research question. And so I say, okay, women that smoke and women that don't smoke. Maybe I should write something on women smokers and breast cancer. So if I'm doing that, my research question would look something like this: is smoking associated with breast cancer risk? Now, that's something that I can research. That's something that I would have answers to. That's something that I can send questionnaires out if I want to do a study or a survey and say, okay, let's see how many women in Lagos, Nigeria have breast cancer. Of these women, how many of them are smokers? Or we can say how many women in Lagos, Nigeria are smokers. Of this population, how many, so we can go either ways, but it's your research. You can decide how you want to go about it. Another broad topic is computer games. And if we narrow it down, we can say computer games and violence. If we narrow it down even further, we can say computer games, violence, and children. And then we have a research question: how does violence in computer games affect children? So that's something that we can write on. That's something we can send out to be published. Another broad topic is eating disorders. And we can do this for a bunch of things where we go, okay, eating disorders. Now I want to write something on eating disorders. Let's narrow it down to teenagers and eating disorders, or adults between the ages of 40 and 60, or 40 and 50 and eating disorders, or male between the ages of 20 to 30. And then we have a focused topic: teen pressure and bulimia. That's very specific. Teen pressure and anorexia nervosa. Teen pressure and anything that has to do with different types of eating disorder. And then we can narrow it down as even further to a research question: what role, if any, does peer pressure play in the development of bulimia? So you see how we go from having a broad topic to filtering it down to a specific research question that would have answers, like is smoking associated with breast cancer risk? If after and what's interesting about research is you can start something like this and find out that, there is really no relationship between smoking and breast cancer. And that's his research paper right there. Now, there's information out there that says there is no risk between, or there's no relationship between smoking and breast cancer. And you have survey, you have statistics. So you can send out a survey, a statistician looks at it and says, okay, so based on this information taken from Lagos, Nigeria between 2020 and 2024, there is no relationship between smoking and breast cancer, right? So I think this is the end.
Yeah.
Take home for you guys is...
Yeah, before you go to the end, so we could, still on our conversational style presentation. So if I may, if I sit down here as a researcher, just like many of the 20+ doctors who are in this meeting now, we'll be thinking to ourselves, what kind of research do I want to do and how do I ask my question? And you've gone through the basic, brilliant presentation, really. And for me as a researcher, I'll think of first, what drives my interest? What am I interested in? Like you said in the beginning, you want to write about something that you're really interested in, because that fuels your passion to continue going even when you hit roadblocks. This thing called research is abstract. So when you hit roadblocks, sometimes you lose the momentum that you started with. But if you are really interested to find out, does pap smear, the frequency of pap smear actually prevent, or is it cost effective in preventing cervical cancer? Then you begin to say, okay, let me formulate a question. Then from the question, I'll get an objective. Then the question you're going to ask is, say, what population am I looking at? So like Dr. Onyi was trying to say, you want to, as much as possible, try to narrow yourself down to a very small niche so that the question you're going to answer will be very specific, niche specific. You don't want to answer the questions that will solve the whole of the problem in the world. It makes your research very redundant, difficult to complete, and also very uninteresting. And sometimes you may not even see where to write it. So if you use the population approach, what population do I want to look at? Let me look at, first of all, age group between 20 to 21 to 29. So you narrow down your population. Then you now think of, okay, so you've added the population. So what intervention, what am I going to do with this intervention? Am I looking at collecting data to see how the frequency of pap smear affects the incidence of whatever, cervical cancer in there? So you are looking at, am I trying to give them some sort of, am I looking back retrospectively to see what happened? Now, when you're drafting this research question, from what I got from what Dr. Onyi said, is you have to put a time frame. In the past 10 years, in the past 2 years, in the past 20 years, or you want to put in the last decade, or over 1 year, or over 5 years, because that helps you to put a time frame and, to put your research in focus. You don't want to have an extensive, unending focus. And then your research question, you also have to, some of them, not all of them, you have a comparison group, like, okay, compared to people that are not having pap smear. So if I'm asking what is the effect, what's the cost benefit effect of frequency of pap smear compared to, so that comparison group helps you to, draw some conclusions, like analytic conclusions, like statistical difference, so because you're trying to make an impact in the, you're trying to come out with an objective or come out with a conclusion that, okay, in these people that have this frequency every 5 years versus these people that have it every 3 years, this is the incidence and this is, the outcome. So there's a comparison group usually. I don't know, Dr. Yi, if I'm echoing some of your thoughts in these drafting research question. You can jump into your conclusion.
Yeah, you are. Okay, so thank you for that. My conclusion is really just a little take home for you guys to work on. So it's formulate a research question regarding health and health-related problems that may be encountered in any field of choice. So if you use this, think of something that you're passionate about, something that if you start working on it and you hit roadblocks, you would keep pursuing because you really want to do this. And I understand that at this stage in our career, we want to jump on every research, right? But at the same time, you also want to say, in 10 years, if I publish this today, would I still stand for this, right? Ethics, would I still stand for this? So pick any topic, women's health, men's health, and filter it down. There's a lot of research that is not out there, that needs to be out there. And it would only happen if we put them out there, and that starts with coming up with your research question. And another thing that I noticed is in the course of writing research questions and working on papers with different groups and different people is you might start out working on something and then you find 2 months into working on it that, oh, okay, so there is more to this. Or, okay, well, I just did not know that this was already out there. There is enough information about this, or there is this exact topic that I'm pursuing that is out there, and you're able to deviate into something else. There was this research that I was working on with a couple doctors in the UK. They got a grant to work on climate change and I think effects of climate change on neural tube defects. And there was nothing like that before. What's the term for them? Neuroenterologist or something. I don't know the name for them. But we started working on it and we discovered, oh, well, we can add more to this. I don't want to put the topics out there because they haven't published it yet.
Right.
Yeah.
Right. I also think in line with your thoughts, there's a hand up that wants to ask a question. Dr. Babalola will take your question. In line with what you're saying, formulating a research question also requires you to go into details, reading other people's work, because in reading other people's work and studying other people's work, you find where those lacunas are, where those, the spaces, the gaps in the research, and the gaps in the information, you find those. For example, I was reading through the USPTF guideline on skin cancer, on how often you check your skin for skin regulation. And that particular document was actually done on a particular ethnic group, and it wasn't done in another ethnic group. So they derived their statistics from another ethnic group and they wrote their limitation. That left a room for, okay, if it's happening in this ethnic group, what is the rate in this ethnic group? What is the effect, or what is the benefit or the cost benefit in this and everything? So it just came to my mind, oh, wow, there's a niche to write a paper or to look at the effect of skin cancer or regular skin checkup, yearly annual skin checkup or thereabouts on these other particular ethnic groups. Dr. Babalola, you have the floor. You can unmute your mic.
Yes, I do. Thank you very much. So you mentioned the PICOT, is that it? I know about the population, intervention, comparison. My question is, must all research questions have that? Because I was thinking it was usually used for systematic review. I'm not sure, because I just heard it when somebody was doing a systematic review. What for a review paper and stuff like that? Do we also consider that PICOT thing when we are choosing a research or that kind of paper?
That is a brilliant question. I'll wait for Dr. Onyi, then I'll chime in. Next week, we're going to be talking on types of research, so that I know many of us here know what are different types of research. We're going to be talking on the types of research, not only talking on the types of research and how you can actually jump in one of those types and produce it in a very time-efficient manner. I think when they talk on those types of research, we'll see where PICOT falls into. But let me wait for Dr. Onyi first, then I will answer your questions directly. Dr. Onyi, you want to say something, or you want me to just take up the question?
No, I could say something. So PICOT is population, intervention, comparison, outcome, and time frame. Oh, sorry, I was getting. Hello?
Yeah, go ahead. Or just, is the system requesting you to start your video? Go ahead.
Yeah.
Okay, go ahead.
Okay, yeah, what was I saying? Sorry. Oh, yeah, I was talking about PICOT. And it depends really, I think, on the research question that you have. So I know, from what I know, is it's a method used in clinical research to formulate a research question, right? So it helps you to begin the planning process, and by doing that, you can be more concise in your statement of work and in the objectives of your research. So for instance, if your research is based on, okay, something you saw, let's say you're reading a paper, this is just a scenario, you're reading a paper and then you find this information is not correct and you're countering that information, I don't think PICOT would necessarily apply to that. Do you get what I'm saying?
Yeah, I'm trying to understand, because I don't know much about all this, so I'm trying to understand what you're talking about here.
So let me chime in a little bit, right? This thing called research is so broad that sometimes there's what they call explanatory research that people don't even know. You're trying to just explain a policy to someone, to some people. And the fact that you're gathering your data, what we know as research is data gathering for a purpose. You're gathering your data and you're trying to explain something. it falls under research. Apart from the basic ones that you know, which is the interventional, the non-interventional, retrospective, non-retrospective, prospective, longitudinal, cross-sectional, and all the rest types of research. For example, a case report, which is the research. PCOT almost always applies to almost all of them. But you know that there's no generalized law. If I come out as a statistician and say it applies to everything 100%, there's nothing 100% because there's infinity, right? In the two arms of the bell curve, it doesn't end, keeps going. So PCOT helps you a great deal in many of them. I'll give an example. If you're writing a literature review, for example, the one that many of us know, what population, what are you, so the word population may not necessarily mean person. What are you writing that literature review on? Are you writing a review on homosexuals? Okay. Over what period? A review on the attitude of homosexuals, for example, or a review on HIV prevalence in lesbians, or whatever it is, right? Or let's just say depression, a review on the effect of antihypertensives on depression. So I've had a population. I'm trying to say, okay, it's people that are antihypertensives and probably develop depression. And then if I add in males, it narrows it down a little, makes it easier for me. So that's a population, for example. If I add in males greater than 18 to 25, it narrows it a little bit. It makes my work sweeter and more easier to come to a conclusion, right? Or if I say in the Medicare population greater than 65, so I have a niche, I have people that I'm focusing on. That's for literature review. Let's take another paper, for example, case report, simple case report. The PCOT also helps you in that case report, because what case are you writing? You're writing about Mr. or if a male or a female who, what is it? What did they do in the case? That's the intervention. What did they do? What are you trying to write about? Are you trying to write about treatment approach? Are you trying to write about negligence? Are you trying to write about a new intervention? So the PICOT does not literally mean those population intervention this. So if you could just oppose it in that case report, you see, okay, I'm trying to write about how ensuring that you repeat, for example, an elevated sodium helps in reducing medical error in a patient who is on sodium, who is on normal saline, for example. I'm giving an example. Then, you know, adding other components of the time frame, right? So this patient that I'm looking at, was it a patient that was in 2017 or 2016, or is it active? Because when I'm writing about a case report, I'm writing something relevant in time. Am I comparing this management to the similar management that was done in the 1960s? Right? Or am I writing just a snapshot? So in my time frame, my PCOT helps my delivery, my discussion. It helps in the outcome, even in the objective that I'm going to end up with as the paper. I don't know if it makes sense.
It really does, because I just got really involved in research this past summer, and I don't think I really I was really told about the PCOT thing in most of the papers I just read. We just pick a topic. So it was very enlightening for me to know about that, and it's going to be like guiding me picking up further questions in subsequent papers. Thank you.
Thank you so much. So there's so many approaches to writing a research question. The PICOT approach is just one of them. Yeah, we'll keep discussing each of them to make this discussion very short, so that to be sweet to listen to when people are listening to it. Dr. E, final few words, or questions, contributions from other people. I know there's so many researchers. Dr. Tom is here, Dr. Rahman, Dr. Okobi today, Dr. Joseph, Dr. Endurance, who's the chief of the cardiology in the house, Debbie, Dr. Pemiro, I welcome all you, Dr. Boma, Dr. Maka, Dr. Bosede, and those I cannot see their name clearly, you're all welcome. Dr. Manandra Sapana, contributions, comments. If there's no contribution or comment, Dr. Onyin has done a very brilliant work in helping us set up a research question. And we hope that by this time next year, you should have set up your research question, answered the question, come up with an objective, and probably get a paper ready, because that's the essence of all this whole conversation, how to help you sit on your own, autonomously think on your own, and get your paper ready. If there's no other question, as we usually do, end the recording. I will play our concluding piece of the video, the inspirational video that we're playing. Now, just wait for 1 second to see if there's going to be comment or contribution. If not, we'll go to our concluding piece.